Hi everyone, my name is Budesonide, and this is my autobiography. My brand names are Rhinocort, Entocort EC, and Pulmicort. My chemical name is
For my drug classification, on the therapeutic classification, I am an anti-inflammatory agent. For my pharmacologic classification, I am a corticosteroid, respiratory corticosteroid, systemic corticosteroid, and plain topical nasal corticosteroid.
my pregnancy category is category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate or well-controlled studies in pregnant women.
For the mechanism of action, short-term consequences of corticosteroids reduce vasodilation and capillary permeability, as well as reduce movement of leukocytes. Corticosteroids binding to the glucocorticoid receptor mediates improve the gene expression that contribute to several downstream effects across hours to days.
This is my pharmacokinetics. My absorption is 20% of nasal inhalation dose, 6 to 13% of orally inhaled dose, and 9% of oral dose that reaches the systemic circulation. My PO form is absorbed from duodenum at pH greater than 5.5, and my oral bioavailability increases 2.5 times in hepatic cirrhosis. My onset is 8 to 12 hours inhaled and 2 weeks oral. My volume of distribution is 2.2 to 3.9 liters per kilogram. I am 85 to 90% protein bound in plasma. I am 80 to 90% metabolized at first pass by CYP3A4 to its two major metabolites, 6-beta-hydroxybudesonide and 16-alpha-hydroxyprednisolone with a negligible glucocorticoid activity. And I am 60% excreted in the urine as metabolites and 40% in feces.
For the indications, first, indicated for treatment of mild to moderate active Crohn disease involving the ileum and/or ascending colon. Second, indicated for the induction of remission of active, mild to moderate ulcerative colitis. Third, rectal foam is used for mild to moderate distal ulcerative colitis. Fourth, various inhaled budesonide products are indicated for prophylactic therapy in asthma and reducing exacerbations of COPD. Fifth, a budesonide nasal spray is available over the counter for symptoms of hay fever and upper respiratory allergies. Sixth, treatment of primary biliary cholangitis. Lastly, treatment of eosinophilic esophagitis.
My contraindications are primary treatment of status asthmaticus and other acute episodes of asthma, patients with a known hypersensitivity to any of my ingredients, patients with TB, herpes infection, ocular infection, fungal infection, viral infection, and immunosuppression, patients with measles and varicella, and patients with edema, heart failure, hypertension, and hepatic disease.
Next is my side and adverse effects. On the central nervous system, my side and adverse effects are headache, dizziness, and tremor. Next is palpation in the cardiovascular system. On the gastrointestinal tract, nausea, abdominal pain, abdominal distension, dry mouth, dyspepsia, flatulence, diarrhea, GERD, and constipation. Next is menstrual disorders on the reproductive system. On the respiratory system, cough, hoarseness, throat irritation, nasal ulcer, nasal septum perforation, epistaxis, and nasal mucosa irritation. The side and adverse effects on the integumentary system are acne, pruritus, eczema, petechiae, and bruising. Lastly, on the musculoskeletal system, the effects are myalgia, back pain, and muscle spasms.
These are the nursing responsibilities that you should consider before, during, and after administering me to the patient. Before administration, examine the nares, assess for untreated local nasal infection, nasal trauma, septal ulcer, recent nasal surgery, and lactation. Take patient's blood pressure, pulse rate, and respiration rate. Advise patient to not use more often than prescribed and do not stop without consulting the healthcare provider. During administration, in an oral dose, administer the total daily dose in the morning with or without food. Do not chew or crush the tablet or capsule. Advise the patient to avoid consumption of grapefruit juice for the whole 8-week duration of therapy. In an inhalation dose, prime pump 8 times before first use. If not used for 2 consecutive days, reprime with 1 spray or until fine mist appears. If not used for more than 14 days, rinse applicator and reprime with 2 sprays or until fine mist appears. Use decongestant nose drops first if nasal passages are blocked. After administration, monitor patients for signs of hypercorticism, which could indicate need to decrease dosage, and notify the physician immediately if the patient is experiencing skin rash, fever, swelling of face and neck, difficulty breathing, or developing an S&S of infection.